The Health Savings Account, or HSA, is your path to both saving and spending for healthcare, with tax savings too. To have an HSA, the IRS says you must be enrolled in a high-deductible health plan, or HDHP. Depending on where you live, Lockheed Martin offers you a choice of at least 3 HDHP medical plans. Also, you can't have other health coverage generally, be enrolled in Medicare, qualify as someone else's tax dependent, or have certain other types of accounts if they reimburse you for medical expenses. If you watched the HDHP video, you saw how the HDHP works. Except for in-network preventive care, which the plan pays for, each year you pay 100% of your medical and prescription expenses until you meet the deductible. Once your deductible is met, the plan pays a percentage of covered expenses, and you pay a percentage called your coinsurance. If you reach the out-of-pocket maximum, the plan pays 100% of eligible expenses for the rest of the calendar year. Here's where the HSA fits in. You can use it to help pay for your deductible and coinsurance. The great news is that you don't pay federal taxes on the money you withdraw from your HSA as long as you spend it on qualified healthcare expenses that aren't paid by any other health plan you have. It's like a savings plan for healthcare. You can make pre-tax payroll contributions to an HSA, which lowers your taxable income. To get you started, you can also earn company-provided wellness incentives that are deposited into your HSA by taking part in certain wellness activities that Lockheed Martin will specify each year, also tax-free. You and your enrolled spouse can each earn up to $500 in annual wellness incentives. $100 for signing up to receive personalized health and wellness messages, $100 for taking a health survey, and $300 for getting a biometrics health screening. The HSA isn't just for medical and prescription expenses. You can use it for dental and vision expenses too, deductibles, coinsurance, copayments, but not premiums. You can also pay healthcare expenses for your spouse and tax dependents. They don't even have to be enrolled in your health plans. You can spend your HSA money as soon as it's in your account, or save it for the future, or do a little of both, like maybe pay prescription expenses out of your own pocket, but use the HSA to pay for medical care. Any HSA money you don't spend remains in your account year after year. You never lose it. When you spend wisely, like when you choose an in-network provider or a generic prescription, you have lower healthcare expenses, which leaves more in your HSA. Each year, the IRS places certain limits on how much can be contributed to an HSA, but there's no limit to how big it can grow. Once your HSA balance reaches a certain level, you have opportunities to invest it so it can potentially grow faster, still tax-free. On top of all these tax advantages, you own your account. If you leave the company or retire, you take your HSA with you, and you can keep using it for qualified expenses in accordance with IRS rules. You can get more information about HSAs from the Destination Wellbeing Portal or irs.gov. Know the rules and get the most from your account. The HSA is a smart way to pay for healthcare expenses and save on taxes at the same time, so you can reach your well-being goals.